Hi, this is Dr. Bird at Allied Physicians in Rehab in Carbondale. This is the trigger point video that is the first area you want to work on. It's working on the diaphragm. Now, the diaphragm attaches on the lower 6 ribs all the way around to the spine, top 3 lumbar vertebrae. So somewhere in this range, that diaphragm, which is the primary muscle of respiration, so breathing muscle, as well as the primary core stabilizer, this is the one I'm going to recommend you work on first before you work on your neck, before you work on anything else, with a little bit of precaution. One, if you have an organ system problem in here, then you need to get an okay from a medical doctor. So for example, tumors or fibroids, or if you have an ulcer or something like that right in this zone, because we're going right up in here, that's the thing you need to worry about. If you have an abdominal aneurysm, probably not a good idea. I wouldn't do it, because you're putting pressure in kind of towards the aorta, which you don't want to do if you have that. Most people don't have those conditions, so most people this is fine. What we're going to do is we're going to go in to the diaphragm right at the rib cage. Come in nice and slow, and we show this on another video, a subsequent video, a hip flexor and diaphragm video, but I'm just going to show you this one. We're going in and we want to breathe the hands up and down. So breathe in, and my hand moves up, breathe out. The hands should suck into the belly. Now breathe in again, hold that pressure. Takes about 3 to 5 breaths usually. Breathe out, and right there on clay, it already released. Feel that? Yes. That was quick. So the person being done on, if you're the person being treated, when you feel the intensity lessen, that's it, it's released, just like other trigger point videos. If you have an issue with where your stomach's full, another thing you might want to maybe do this on a time where your belly's not full. But that diaphragm trigger point, I am seeing crazy improvements with somebody having a neck issue. Do that and their neck feels better. The muscle tightness is less. Hip flexors attach directly to that. Go ahead and drop your legs for me, but the hip flexors attach up in through here, right at the bottom part of the diaphragm attachment. So if this is tight, it loosens this up, which can send off a chain reaction all the way down the leg and make the whole leg loosen up. I had a patient that came in with an ankle tenderness and no other symptoms, but I checked all the way up her leg, all the way up. One side was tight, tender in the ankle. Other side, no problem. As a little experiment, I did a trigger point on her diaphragm. Went back down, she said her ankle was 75% better. Crazy changes with this, so definitely work on this with the precautions I mentioned earlier, and it's all about breathing, okay? I show other videos also how to use a Theracane or a tool where you can take something like the end of an umbrella and put a towel right in there, a little buffer, and then pull on like with the handle of an umbrella, so it's kind of flat, about that big around, pushing in, if you can't do it with your own hands, if you don't have a partner. So try this out, see how it goes, and then check out the other videos.